The next important thing is the JVP. So remember, this is the jugular venous pulse pressure. Okay, jugular venous pulse pressure. Please don't say or don't confuse both of them. Many often it is seen that the radial pulse and jugular venous pulse is often confused and a wrong answer is given. So this is our JVP, that is the jugular venous pressure, also referred sometimes to as the central venous pressure, which is actually reflecting the pressure changes in the right atrium. Remember, when you can examine this by the Thomas Lewis method, you ask the patient to sit at 45-degree angles, keeping a pillow or a back support, and you measure this in your veins by using two scales. You keep one scale vertical over here and one scale horizontal, the Thomas Lewis method. You learn this in your practical, isn't it? You learn this in your practical. That is the jugular venous pressure, which is giving you an idea about the pressure changes in the right atrium, right? It has got 5 waves. 3 are positive, A, C, V. They are positive waves. Positive means these are the pressure waves which are because of increase in the pressure, increase in the pressure in the right atrium. X and Y are negative waves, which is because of the decrease in the pressure in the right atrium. So this is reflecting the pressure changes in the atria. So what are the causes? A wave, positive wave, is because of atrial systole. That means the atrial contraction is resulting in the rise in pressure in the atria, and that is atrial systole, A wave. C wave. Now this C wave is occurring due to the events which are taking place actually in the ventricles, but they are causing a rise of pressure in the atria. So the C wave, it coincides with the onset of ventricular systole. With the onset of ventricular systole, when there is bulging of the tricuspid valve, when there is bulging of the tricuspid valve into the right atrium. Did not we study that in isovolumetric contraction? What happens in isovolumetric contraction? How does it begin? There is closure of the AV valves. That means the bicuspid and the tricuspid. Now this, we are speaking of the jugular venous pulse. That means only about the pressure in the right atrium. So as the tricuspid valve, it bulges into the right atrium, it causes a very small but a very acute increase in the right atrial pressure, which is reflected as C wave in the JVP. Then V wave. V wave is the rise in the pressure of right atrium. Okay, rise in the pressure of the right atrium due to increase in the venous return to the right atrium. So as the blood is returning from the great vessels into the right atrium, again the rise of pressure is reflected by V wave. So 3 positive waves. Then 2 negative waves, X. X is actually indicative of the relaxation of the right atrium. Okay, during relaxation of the right atrium, there is fall of pressure in the right atrium. And Y wave. Y wave क्यों होता है? Again, due to a fall of pressure in the right atrium when the blood passes from the right atrium to the right ventricle. So during the filling of the ventricles, as the blood passes from the atria to the ventricles, the volume in the atria decreases and so the pressure also decreases, right? So this is very, very important as a short answer. It is important for the practicals also. So remember, right venous pressure or jugular venous pressure is reflecting the pressure in the right atrium. Normally the jugular venous pressure is very, it is not obvious. You cannot see the raised jugular venous pressure in any condition. It is just 0 to 4 centimeters of water. But raised JVP is a significant feature of right heart failure. Okay, or it can be seen in physiological conditions where there is increase in the blood volume like in pregnancy. Otherwise, it is a very significant feature of congestive cardiac failure or the right heart failure, or in physiological conditions of increase in the blood volume like in pregnancy.